My name is Kunal Shah. I'm a electrophysiologist in Austin. I work for the Dell Seton Ascension group and been in practice for about 3 years.
I had the good fortune of knowing you very briefly
Yeah.
as you were coming into clinical
That's right.
practice.
That's right.
What is one piece of advice you would give to someone starting out as a new attending electrophysiologist?
Good question. I would say be safe and pick straightforward cases. Don't go after complicated, really challenging cases when you first start. And follow the guidelines. I think as you get further along, you can get a little bit more risky, so to speak. And still remember to be a good cardiologist, because that's a big part of our practice too. So we get really focused on the specifics, but we often forget, how do we treat hypertension, that sort of thing. So stick to the basics and probably pick the low-hanging fruit.
I think that's a beautiful answer. And as a humble plumber at an electrical meeting, what would you say that is one piece of information that every non-EP cardiologist should know in 2025? What do you wish we knew that we don't necessarily always know?
Good question. I think that know that we all speak the same language because we're all baseline cardiologists, so we can mostly understand what you guys are saying, and that our field changes rapidly. So what you guys learned about AFib ablation, even as recently as your time, may be different than what we're doing now with the technology changes. So, yeah, those things.
And in terms of AFib ablation, is that an area of interest for you?
Yeah, I think it's, as an EP doc, it's probably the most common thing that any of us do. We do, as you know, sometimes 3 to 4 or 5 a day. And so it was something that if you're watching it as interventionalist or non-invasive, it's very, very, very boring. But to us, it's very exciting, especially with the technology. So now AFib ablation can be done faster and safer than ever. You see all these commercials and all these billboards for pulse field ablation, and that's kind of the newest thing in our field. So yes, still part of an exciting part of our practice. So basically, we traditionally would use thermal energy or freezing energy to isolate the pulmonary veins for an AFib ablation, and pulse field is essentially direct electrical impulses for short periods of time. Been used in other fields like cancer for a long time, and now it's coming to the AFib space. So basically a safer, somewhat faster technology.
And how has the adoption of this new technology been globally? Like, would you say that most people have started to do this technique?
Yeah, so a colleague in my practice, Dr. Hong, you may know, now does 100% PFA cases. So it's going to become that way. In Europe and Asia, it's going to be very, very common. And the US, I think, probably the next 5 years, it'll also be probably 80-90% of this technology.
I'm curious, so what do you think makes new technology adaptable into a clinical setting? Like, why is one procedure going to be adopted more quickly or more widely than another in this space of EP?
I think in this space, I think we're always trying to get better outcomes. So the pulse field outcomes in the early studies don't look as promising as we hope in terms of being better than radiofrequency or heating energy, but that will likely change. And so I think we're excited about making that gap of treating AFib even more effective. And so that's why anytime new technology comes out, we kind of jump on it. The biggest thing we've seen is that it's certainly safer and faster, but it's, I think, our goal to try to get better outcomes, and that's where we're excited about anything that new that comes out.
So really the data drives the adoption of the technology.
Yes, yeah, data, and I think the safety of that technology also can drive it too.
So could it be that the plumbers and the electricians are not that different?
We're very similar.
And my last question for you is this. It's 6 p.m. on a Friday. You've done all your ablations. You're not on call. Where do we find you? What are you doing?
6 p.m. on a Friday. Friday is my personal day for just me, myself, and I, so that's like my self-care day. So probably taking a long shower or a bath, making myself dinner, and going to bed really early.
Amazing. What is your scent of choice? Lavender, eucalyptus?
Good question. Probably lavender, yeah.
Amazing.
Yeah.
The things we learn at EP conferences. Thank you so much for talking
Thanks
with us.
Thanks a lot. Appreciate it. Thank you.